Hey everyone, it's Tyler with Life Touch Hospice. There's a new resource that just came out today, and I wanted to kind of walk through it and guide you through it. Hopefully, it is of use and a beneficial tool to someone out there. In a lot of talks I've given, I've talked about the Conversation Project, and they have different conversational style worksheets, for lack of a better term, and they're called conversation starter kits, and they do a wonderful job of helping guide people through a difficult conversation that people with serious illnesses or progressive illnesses, to guide them through some really important concepts and things they need to be thinking about before they approach their family, before they approach their medical team with these really heavy subject matters that entail a lot of what you're feeling and what you want. And some of these things that we don't always cover in medical talks, but that are key to your medical treatment to make sure you have control, or as much control as you want, that you have presented to your medical team the information of what you want your preferences, or what your preferences are. And those are very important to think through. And at the end of the day, it's about knowing yourself better, making sure your family knows you and what you want, and making sure your medical team knows what you want. And that could be making sure you get the care you want, also making sure that you don't receive the care that you don't want. So it goes both ways. It's not just about taking potential care away from people. Like, these are all conversations to make sure you don't do something. And that's not the case at all. This is to make sure whether you want the most aggressive treatment or the most comfort-based treatment, or anywhere on the spectrum, wherever you are in that, you deserve that, and you deserve to get the care that you want. And so there's a lot of tools out there, but this is a brand new one that I think just came out today, and I wanted to show you through it. So up on the screen here, you should see something called the What Matters to Me Workbook, and it has name, date, so make sure you kind of like a workbook, almost like you're in school, but it's the topic of serious illness. And so as we go on to this, it explains what this is for. And so you can read on here what it's for, and I'll put the link up in this video as well. You can also go to our website, lifetouchhospice.org, and you'll see the link on there as well as some other resources that are useful for this time, for serious illness, or for a family member with serious illness, those sort of things. So the workbook is designed to help people with a serious illness get ready to talk to their health care team, doctor, nurse, social worker, etc., about what is most important to them to make sure they get the care they want. Again, it's about getting what you want. We want control over a lot of areas of our lives, but when it comes to serious illness, when it comes to those last couple years of life, the last 6 months of life, we almost kind of give up control of that because we don't know what to say, we don't want to talk about it, or we don't know how to talk about it. And so this is to say, well, we do know how to talk about it, but it takes working through it, and it takes some guidance through it. So you'll see on here, it starts with, what is your understanding of your current health situation? How much information about what might be ahead with your illness would you like from your healthcare team? So this is really important because there's a lot of miscommunication between patients and their medical team, because you may think you're in one place with your illness when in reality you're in a totally different place. Unfortunately, we receive a lot of referrals and a lot of patients that when we go to them, obviously we're hospice and we are end-of-life care, and this is even tough to talk about, but it's the reality of what we see. Several times we're the first people to tell them that they're at the end of life. And so it's a really tough conversation when we're approached being told by their medical team that they are appropriate for our care, yet no one's talked to them about it. And so now the first time they're confronted with this conversation is with a hospice team. And you can imagine how difficult that is for that family. And so this is important because you may have one perception of your health and your medical team may have a different perception. And you really want to be on the same page so that you get the care that you deserve, or that your family member gets the care that they deserve. So we go from here. How much information would you like to receive? Some people don't want any information. They say, whatever you think, doc, whatever information you think I should have, great. And some people say, no, I want to know everything. Well, that's your right. Whichever end of that spectrum or anywhere in between you fall, you deserve whatever amount of information you want. So we go from there into an About Me section. It's kind of funny to think of healthcare in these terms of presenting your team with an About Me. But it's important because if your medical team doesn't know your preferences in life, how can they treat you like a person? Because your illness fits into your life. And your life will dictate what type of care you want. If you want to do certain things in a specific test, or not test, but a specific treatment or surgery has the potential to prevent you from doing the things that you really want to do, it's important that the medical team knows that it presents that possibility, so that they can weigh out the pros and cons and say, well, it's a 20% chance, roughly speaking, that you won't be able to walk if this surgery ends up causing a certain amount of harm. Well, if you say, I'm not okay under any circumstance living the rest of my life not being able to move, or not being able to communicate, or not being able to eat ice cream, or see a ball game, or whatever it is, insert whatever you're okay with or not okay with in life, you need to be assessing those things on a very specific basis, person by person basis, with your medical team to say, I'm not okay. If this causes this, I'm not okay with that, and I don't want to take that risk, even if it means possibly living a shorter overall life. And that's a whole realm of conversation that's tough, but it's really important that you don't go into these things with lack of information, and that your medical team doesn't go into this with a lack of information. Because on the other end of that, if something does happen in a surgery or with a treatment and leaves you in a place that you really didn't want to be, well, now there's this whole feeling of, did we do the right thing? We didn't know when we could have known. And the medical team doesn't want to cause you that harm. Their whole thing is to not cause harm. And so it's important that they know what your preferences are to make sure that they don't cause harm. Because if they never know, if you never told them, if you don't even know yourself, that's why it's important to explore these topics. So we go down, what does a good day look like for you? What does a hard day look like? What are your goals? And that doesn't have to be the goals of going to the Grand Canyon, or going to Alaska, or hiking up Kilimanjaro, or whatever the case is. It could be, like it says on the sheet here, take my dog for a walk, attend my son's wedding next September, go to church, talk to my grandchildren when they come to visit. Goals are important, and they change throughout life, right? So what is one person's goal at 20 is not a person's goal necessarily any amount of time later, especially at a progressive state in an illness. So it's important that your medical team knows those goals to try to help make them happen. So then you go from there to my care. And what I really like about this section is it's not black and white. Now, this isn't an advance directive. It's not a legal advance directive, and it's not meant to be that. And we'll get to that later. This is on a spectrum. So it's not, I want this or I don't want this. It is, how do you feel concerning this? As a patient, I'd like to know only the basics, or I'd like to know everything. Or maybe you're in the middle. You can see these dots there that show I'm somewhere on the spectrum here. And that's okay. There's no right or wrong answers here. This is just where you stand and what you think and what you believe and what you feel. So you go through there, fill all that out. If my health situation worsens, I strongly prefer to be in a healthcare facility. I strongly prefer to be at home, or I'm somewhere in the middle there. Some of these types of questions are very important, and they're really questions that aren't black and white. And some forms frame them as yes or no questions. I think this is a much more accurate portrayal of these questions, that that's on a spectrum. So we go into the next section of write in stuff. So this is free to write whatever you want in there. Again, I like the personal aspect of this, that you can put your voice onto this. not just checks yes and no, but your actual voice, your wording, your personality in this. That's how personal this is, and that's how personal it should be with yourself, with your family, and with your medical team. So my fears and worries, these are the main things I worry about. And you can see some examples there. My strength. As you think about the future with your illness, what gives you strength? So it's not just what are all the negative things. Let's think about all the negative things and the horrible things that could happen. That's not the point of this. The point of this is to look at everything and take in the reality of the situation, which includes beauty and horror, good and bad, strengths, weaknesses, everything, just like life. So what are your main strengths in this difficult time? Friends, family, faith, garden, sports, ice cream, myself, whatever it is, it's important that you lay that out there, because when those difficult times come, how great would it be for your medical team and for your family to know what brings you strength to help pour into that, and not just be left wondering, well, I wish we could uplift them in some way, or I wish we could send them a card that with something on there. Well, if you let people know what your strengths are, they can help pour into that. Or if this is your wheelhouse, to pray for them that they be strengthened by these things, and we can be specific. And there's a lot of implications for forms like these, but it's all about getting to know yourself better and knowing your family and those you're taking care of better on a medical side. So my abilities, what abilities are so critical to your life that you can't imagine living without them? I want to keep going on as long as I can do any of these things. And again, you can see examples on there. As long as I can sit up in the bed and occasionally talk to my grandchildren. As long as I can eat ice cream and watch football. As long as I can recognize my loved ones. As long as my heart is beating, even though I'm not conscious. So again, you can see that this goes from one end of the spectrum to the other. Is even if I'm not conscious, if my heart is breathing, I'm okay with that. So whatever we do, whatever medical treatments could even cause complete lack of consciousness for however long, as long as my heart is breathing, I'm okay with it. To on the other side of, if I'm not able to play golf, or if I'm not able to eat ice cream and enjoy it, if I'm not able to communicate effectively, I don't want to try that treatment. And so you have these ends of the spectrums, and you fall anywhere in between. But it's important that both of those be covered, because again, this is about getting what you want, or getting what your family member wants. And so on the other side of that is, if I become sicker, which matters more to me? Pursuing the possibility of a longer life, or pursuing the possibility of a good quality of life? Now, are those always mutually exclusive? Of course not. But there are things that will reduce the quality of life, and they may or may not improve quantity of life or a longer life. And this is just looking at the reality of which becomes the most important part, which matters more to me. It's not that one doesn't matter at all and one matters completely. Again, it's this flowing thing that throughout life, some things matter more than others. The priorities shift, and this is saying, which is the priority? It doesn't mean living longer isn't an important piece of this conversation, but how much of a percentage of what matters to you is quality of life versus quantity. And so that's an evolving conversation, but it's one that needs to happen. And it shouldn't be just assumed that longer life is what matters, or that quality of life is what matters the most, because it's not, depending on the person. And it's important that this is personal to you. I'll say that 1,000 times, but it is. It's about what's personal and it's personalized to you and what's important for you. So my wishes and preference, again, going back to what are my preferences? Here's what I want to make sure does happen. And then on the other side, here's what I want to make sure does not happen. There's examples there as well. And what do you want to make sure your family, friends, and clinicians know about you and your wishes and preferences for care if you get sicker? This is more room to write in what you think and what you feel. And again, this isn't a legal advance directive, and it's not meant to be that presented form that you give to your medical team to say, these are the exact wishes that I have. This is my healthcare proxy. That is a different form, and I'll put that up as well as a link to state-specific advance directives. But what this does is helps prepare you to fill that out. Most of those advanced directive forms are pretty black and white. They are, I want this, I don't want this. You may have a spot to write in and those sort of things, but it's not as um, personalized as this type of form. And there's a reason for that. Is when those directives are called into being, or when those healthcare proxies become official, when the person loses consciousness or they're unable to make a decision, then those immediately take effect, and you really need to know what the person wanted. There's no room for those. Well, it's a spectrum. It's like, well, you really need to know by that point what direction the care needs to go in. So what this does, provides a lot of that same information, but it's not the legal form. So make sure you take that information and go fill out an advance directive. And again, I'll include that link here. But and you can present this information to your physician, to your clinical team, but again, it's not the legal portion of that. But who is going to make decisions on behalf of you? So if you filled out an advance directive, you can say, yes, I've talked with the person that matters most, and that's important, but it needs to go beyond that. I filled out an official form naming this person as my healthcare proxy. So it's great to talk to them and make sure they know, but if that information never makes it to a form and to your clinician, then it's almost like you never had that conversation. Depending on the state you live in, you may not get the phone call, or you may not be with that person when the emergency happens and need to make those decisions. So your team needs that, your medical team needs to have that information, and it needs to be the right form. So that's a yes or no. Then I've checked to make sure my healthcare team has a copy of the official proxy form, and I urge you to do whatever it takes to make sure that's a yes, to make sure you check yes on that box. So again, it goes beyond that. Who are the main people who would be involved with your care? And then make sure you list their information for the team to contact them if you want. And that goes into the next part of how much do you want them to know. But included in that main people, like it says on there, could be your faith leaders, your pastor, your deacons at your church, your Sunday school, whatever, your friends, family are all included in that. Whoever you want to be involved in that holistic care, to make sure you're provided for and cared for physically, emotionally, spiritually as a whole person. And then it has my healthcare team. So then you list all your other specialists, your healthcare providers, your primary physician, those sort of things. And then any questions you have that you would like to discuss with your healthcare team. This could be anything. Again, there's examples there, but anything you think of that's even remotely relevant to this, write that down so that you have that on a piece of paper or in a digital file, that you have that ready to go when you're talking to your healthcare team. A lot of times you get into a situation where you may not hear the things you're expecting to hear, and it throws you off. You don't know what to say. You get some news that you weren't expecting, or maybe just the whole atmosphere of it isn't as comfortable as maybe it could be. And so you're thrown off and you don't know, what was that thing I needed to ask? I don't remember how many times I've taken my daughter Lizzie to Dr. Ray here in town, and I had like a list of questions I was supposed to ask that my wife gave me. Sorry, Emily. And like I forget one or two of them. At best, I forget one or two of them. Forget to mention, oh, well, she had a sore throat, but also there was a cough, or she started having a runny nose 2 days ago, or whatever the specifics are. But if I had written those down, if I took my own advice, to write those down, that way when I go, or when you go, or whoever it is, that you actually have that tangible thing to go off of. And there's some comfort and some security in that. And so I urge everyone, again, all the links should be up. All the information's on here. And you can always reach out to me. My information will be on here too. That you reach out to me if you ever need any help with these sort of things. If you feel like you want to talk to someone about them, you need someone to help guide you through these things sometimes. But take these forms, work through them, fill them out, and it really will help in the progress of your care, and helps your medical team know more about you, helps you know more about yourself, and your family know more about you. And really, that's a beautiful thing. And the more we discover about ourselves, we may find some things that we didn't even know. And chances are there are a lot of things within ourselves that we don't even know that we need to parse out and dive into. And if we never discover them for ourselves, what are the chances that our medical team or friends or family are going to discover it? And if they do, it'll be an emergency situation, and there can be a lot of regrets and things associated with that. So I urge everyone to look through these things, fill them out, make sure your medical team knows about you, and follow the advice here. And what to do next, in the next steps of this, can really make a dramatic change in your health care for yourself, for your family, and as a medical provider. People should be making sure their patients have these forms as well. That it goes both ways. That it's not just the patient doing all the work to get to their physician, their clinical team, but that the medical team also takes the time to give these forms out. So I would urge you to take these forms to your physician and say, or to the nurse or whoever you're seeing, and say, hey, here's this thing that I think is important. Could you make sure you get it to some other families who are going through a similar thing as me? And through that grassroots effort, really trying to make sure that people's priorities and preferences are exactly that, a priority for the medical team and everyone involved. Anyway, so thank you for your time. If you're still watching this, I appreciate you. Hopefully this is helpful. Again, holler at me, email me, call me if there's anything we could ever do to provide either some guidance, counseling, or care for you, your loved one, or someone you know. So God bless. Thank you. I appreciate you.